Why do we care about scoliosis? And what or when does it matter if there's a curve in your spine? I think this is important because with my teenage patients specifically, only about 20% of them have back pain. And 80% of the scoliosis kids don't really have back pain. Some of them do, most of them don't. And so a lot of them come in here and they've been dragged in here with their parents. And one of the first questions I ask them is, do you ever wonder what's the big deal with this? And usually, if it's an 11 or 12-year-old, they'll look at their mom and then they'll be like, no, I don't know why this is a big deal, because they don't have back pain. They don't have, so when is it a problem? When should it be treated? And why should it be treated? I think is a big piece of the puzzle. So there's a natural progression of scoliosis in some people. Not all scoliosis will progress, but there's some that do. So adolescent and juvenile, growth is the enemy. So Misty, if we talk, do you mind if I mention Harper? You good with that? So Harper's 6 years old. If growth is the enemy of a 6-year-old with scoliosis, she has a long time left to grow, right? So we have a lot of growth with that. Liam, how old are you?
20.
20?
Yeah.
You growing still?
Yeah.
Yeah? Which is kind of crazy. Boys can grow into their 20s. Most girls are done growing when they're 15 or 16. So growth is historically the enemy of scoliosis, where as you grow, the scoliosis can get worse if you're an adolescent. As we switch over to adult, most adults aren't growing anymore. Most adults are starting to shrink a little bit when we start to see some scoliosis. Anybody experience that? Yeah? I've lost a little bit of height too. I'm 44. I'm like, how did that happen? I don't have scoliosis, by the way. But we have age-related degeneration in adults that can cause progression. And over time, depending on the size of the curve, we can see progression as well. So, I think this is the biggest question that I get from my patients is, will this get worse? Can it get worse? How do I stop it from getting worse? I think that's probably the question that most of you have. How do I keep it from getting worse? So let's go over adolescent and juvenile scoliosis real quick, and then we'll get into adult scoliosis. This is one of my first scoliosis patients. She was, I can't remember how long. I'd seen her for like 6 years because she was diagnosed pretty young. But if you look at her back, it's kind of hard to see her scoliosis. But she had a 43-degree curve in that picture. So that's a pretty big curve. She did end up having surgery, but I actually saw her dance at Capitol Theater last year, which was pretty cool. So it's interesting. She hides it well, but it was still there. So 0 to 9 degrees, it's not even considered scoliosis. Once we get to 10 degrees, 10 to 24 are mild curves. They're treated with scoliosis-specific exercise. There's sometimes where we do early nighttime bracing with those kids. If they get to like 20 degrees, sometimes we'll do a nighttime brace. 25 to 44 degrees are the moderate curves. We brace those and we continue the scoliosis-specific exercise. 45 plus, those are severe curves, and surgery might be needed in those curves. Does anybody know why surgery is needed in curves that are over 45 degrees? Any thoughts? No?
Maybe a surgeon has to go and manually move the bones into place.
It does take more of that, yeah.
As it curves, it can affect your lung and heart.
Right. So that's the concern if it gets bigger. That usually doesn't quite happen until 60 to 70 degrees of curve. Sometimes they can happen before that. But 45-degree curves and above tend to continue getting worse even though someone's done growing. So they usually do surgery to stop it from getting worse and not getting to that point. But definitely if they're having lung and heart issues, yeah, surgery is definitely indicated in that. So we want to try and keep a curve from getting to 45 degrees. 50 degrees used to be kind of the surgery cutoff, but they kind of dropped it to 45 because those tend to continue getting worse. So yeah, we'll talk about surgery. I'm not a surgeon, so we'll talk about it semi-briefly, but I've been doing this for long enough that I have a lot of patients who have had surgery, very successful surgeries.
So
But
do you still need therapy after surgery? You still help them after that, or?
I'm a little biased, but yes, I think so. We just finished developing a post-op protocol with the surgeons in the area, the pediatric surgeons. So, because before it was the surgeons would say, "Oh, they do fine after surgery." I'm like, "They do fine after surgery until I have to see them 2 years later because there were issues from after surgery." So now I'm trying to get them doing something rather than nothing after the surgery. So, and there are a lot of things that can be done after surgery. Adults, it's a different. I think every adult with scoliosis surgery should have rehab afterwards, specific to their curve, because that's a big surgery, and we have more comorbidities in adults than the youth. So let's talk about adult scoliosis. We have the same classification as what we have with adolescent. You know, the 0 to 9, 10 to 24. You know, that same classification. We can see increased progression during menopause. It's interesting. We have in adolescence, puberty is that growth spurts around puberty are what make it progress. And then later on in life, unfortunately, women can have it progress with hormone changes during menopause. So we see degeneration and arthritis cause a progression of the spine, because if you have some scoliosis and you start to get arthritis, it doesn't degenerate on one side equally to the other side. And so we see that progress. And larger curves statistically can gain 1 to 2 degrees every year. Big curves can. So if someone has a 45-degree curve when they're done growing as an adolescent, if they gain 1 degree every year, 20 years down the road, they have a 65-degree curve. You know, so that's why surgery is usually done at 45 degrees. So this is an Olympic swimmer. Her name is Natalie Coughlin, I think. I don't know if you guys remember her, but I saw this picture online when I was looking up some scoliosis pictures, and she has a significant scoliosis curve. I think it's in the 30s. And Olympic swimmer, you know, does a ton with scoliosis. I mean, you have Usain Bolt, who has scoliosis, fastest guy in the world, right? And there are plenty of other people who have scoliosis. So the question is, why treat scoliosis? So you guys are here because you don't want it to progress. So one thing, understanding why we want to treat it. So I think in my adult population, reducing pain is the main reason that people come and see me. A lot of times it's to stop progression, but it's because it started to stop you from doing things, or you're having more pain with doing things that you enjoyed before. Reduce or stop progression of the curve, that's across the board with all of my scoliosis patients. We want to stop progression of the scoliosis or kyphosis curves. Improve strength and physical function. I mean, we sometimes see that we have more difficulty doing things, and so we want to increase physical function. Like we already talked about with heart and lung stuff, sometimes it's about increasing pulmonary function. And it's not very often that in the US we let curves get to where they're really compromising the organs. But I went to China a couple of times to do a wheelchair training, and I was walking through Beijing at night because I had jet lag, and I'll probably get lung cancer from running in Beijing during that time. But I went across a bridge, and and I mean, there's just people everywhere. It's like 1 in the morning, and there are just people everywhere still. And there was a guy scooting around on a skateboard with a huge scoliosis curve. Just, I mean, it totally hadn't been treated. We don't let curves in the U.S. get to that point anymore. And that's great. So we don't have as many pulmonary function issues. Sometimes we still do. I've seen some patients that want to be treated for that or cardiac issues. But I think the main reason we treat scoliosis a lot of times in people's minds is to avoid surgery. I mean, in this room, how many of you are here because you want to avoid surgery? Yeah? So it's a big, Liam's like, yeah, I want to avoid surgery.
Well, depending on, so I've been, and it's really risky, so it's like, it's too risky for you.
Right. And there is a risk to it. And I mean, we were talking about the risk of the nerves coming out of the spine and what do you do with those. But in adults, there's also other risks, like, because sometimes we have cardiac issues that go along with that. As you get older and we talked about this earlier today, after you get to the age of 80 and above, a lot of surgeons won't do surgery on that because it's just too risky. And so sometimes surgery isn't even an option. But when it is an option and we're not to that point yet, maybe we're at an 11 or 12 degree curve and we want to avoid surgery because that might be down the road, right? So,
Do you know, like, or do you have any, I mean, it probably isn't really your area, but
yeah.
how, does it come right back? How effective is the surgery? Is it going to come right back in 5, 10 years or whatever? Or?
If the surgery is done correctly, it won't come back because those vertebrae are fused, so they can't curve again. But then you have the concern of the vertebrae above and below the fusion. That's where the concern comes in. Like, how far do you do a surgery so that we protect above and below the fusion?
How often,
So,
what's the incidence of those rods breaking?
depends on the size of the curve. So I did a podcast episode with one of my patients last week that I'm gonna put up next week. Biggest scoliosis surgery I have ever seen. She's now fused from C3 all the way to her pelvis. So it's just a really big fusion. And she's done awesome. It was either that or be paralyzed, so it's like, okay, let's do this risky surgery. But, and this is from radiation exposure because of cancer. So this isn't like idiopathic, this is something different. So she comes in one day and she's like, I'm having a lot, this isn't funny, but she was having a lot of pain in her back, and she goes to her surgeon. He's like, oh, you broke a rod. She's like, I broke a rod? She calls me up like, I broke a rod. And then I talked to her surgeon. He's like, she's going to break rods for years because the surgery was so big that he expects those rods to fail. I'm like, what? You're expecting these rods to break? I had no idea. He's like, yeah, I'm expecting these rods to break. We'll go in and replace them, kind of like replacing your tires on your car. Like, okay, I guess that's a different outlook than I had thought about before. But she is the most amazing lady, though, like totally upbeat. When I saw her the first time, she was actually bent forward like this. She recognized people by their shoes because she couldn't look them in the face. And now she stands upright and can look me in the eyes. So pretty cool surgery, but there are risks associated with those. So we'll talk about surgery a little bit more. Any other questions on this? Any other reasons that you guys are looking to treat scoliosis? Sometimes it's because of the look of it. Sometimes it's like, I don't want people to notice that I have a rib hump on my back or my pelvis being shifted. So sometimes it's cosmetic.